Expectant moms in rural areas already have limited access to labor and delivery services. But a recent study shows that the problem could get even worse.
And that report says fewer than half of Tennessee's rural hospitals offer obstetrics care. Sorry about that. And several of those are considering dropping the service altogether.
Fox 13's health reporter Mandy Rock explains where moms-to-be can turn in the Mid-South if they are having trouble finding care.
Here at Regional 1 in Memphis, doctors deliver babies every day. But people who live in rural areas often don't have places like this to turn to. This massively increases the risk of complications for both expectant mothers and their babies.
It's your baby. You're going to do whatever you can to get to take care of it.
Casey Shannon is preparing to welcome her baby girl into the world in just 7 weeks. She travels 40 minutes from her home in Millington to Baptist Women's Hospital in Memphis for care.
Definitely difficult if you don't have a vehicle that is reliable and if you don't have a village to help you get there.
That's the reality for many expectant mothers living in rural areas. A new report from the Healthcare Quality and Payment Reform says more than 100 rural labor and delivery units have closed since 2020. It says of the 24 rural facilities in Tennessee offering obstetrics care, 5 are considering dropping the service. Of the 18 in Arkansas, 5 are at risk of closing, and 3 of the 23 in Mississippi are at risk of shutting down their service. Financial and staffing shortages, along with low reimbursement rates, all play a role.
I think that is almost a tragedy for some of them because that's all they have, and everybody needs health care.
Vicki Terry helps lead the NAACP's My Baby for Me program in Memphis. She said the lack of access puts mothers and babies at serious risk.
But when you have women that have problems that they might even have babies early, and it takes you an hour and a half to get back into the city, that is not a good thing.
That's why Terry said they're doing what they can to help connect mothers in those areas to resources. If they're close enough, she said the program will pay for Ubers to get them to Memphis for appointments. Mothers we spoke with said it takes a village.
So if you have people that, can help you, reach out. That's all it takes. Just ask for the help.
Covering your health, Mandy Rock, Fox 13 News.
By the way, the word is